Okay, I just did a small trick. I just learned to wish you guys in Nepalese for good afternoon, Shubh Divso, my Nepali friends, brothers and sisters. We are not a faraway country. I just saw that the dialect is different, but the script is Hindi. I mean, we were all well connected in the past, and I'm sure with this collaboration, this amazing venture of introducing Neodent and the Storman group of products in Nepal is going to be a milestone in the development of excellent oral health possibilities for the citizens of Nepal. And it's going to be a real privilege to do this honor of introducing the system. Rakshit did a great job of showing you the products, the portfolio, the inventory, the indications, the applications of the different kinds of abutments and the selection of the abutments. My job, so we had a role play. We decided when we were on the flight, is like, Rakshit, what are you going to do? What am I going to do? It's like, he said, I'll show you the products, I'll make them brief through the products, and Anand, you show them the cases. Sorted. That is what a dentist needs. Indications and applications. That is what we need exactly to fulfill the desire of any possible prosthetic outcome. What we need is an indication for a particular product and the application and a clinical scenario. So my job is to show you the application and the clinical scenarios. We already, Sandeep took you through the overview of the company and the iconic success of Neodent and the legacy of 30 years. It all started off in 2003, and primarily what became a grand success is that they kept on innovating. So we don't have an implant design which is a 15-year-old design which is still successful, so people are using it. No, it kept on improving. You saw from Titamax, they went into Alvin, from Alvin they went into Drive, and now they have come out with something which is more of a homogeneous or a hybrid design of an implant which is conducive to any kind of osseous application, be it extremely dense bone to extremely porous, soft, spongy bone. So you have one implant design which works with versatility in any kind of bony classification, but at the same time it has an array of please mark my words, I am a very good Straumann user and a Neodent user, and I have tried many other implant systems in the past. The kind of prosthetic portfolio and the exhaustiveness which Neodent offers in terms of conventional and digital workflows, barely there are few other systems which will offer you that kind of flexibility in terms of abutment diameters, collar heights. You can go very specific, every millimeter to millimeter for your soft tissue profile and complete the case. So patient who requires an implant supported overdenture, it is considered and categorized under a Neoarch procedure. I have not included that as a part of this presentation, but we have novel of attachments, bar and clips, ball and sockets, all those prosthetic options which are available for full denture. But when it comes to a classic Neoarch, we are talking about literally an all-on 6 in the upper or the lower jaw, or an all-on 4, or a combination of regular conventional implants along with zygomatic implants, or a combination of regular implants with pterygoid implants. So that comprises the concept of Neoarch, and the main ideology behind Neoarch is immediacy. So it's not a rocket science of just calling the patient, anesthetizing, placing implants, and then telling the patient, now continue wearing this complete denture for the next 3 months. Don't show your face and come back after 3 months and let us think about the prosthesis. No. Prosthesis is planned beforehand, either digitally or conventionally. It is right next to you. You operate on the patient, you do your surgery, and the prosthesis is delivered on the same day. That is Neoarch. So the concept of Neoarch and immediacy go hand in hand, and we believe strongly in the same. What is the risk factor? Rakshit kind of hesitated on talking about the entire risk factor associated with partially edentulous cases of single tooth. Single teeth immediate loading are the most scariest and most riskiest ones. Full arch cases are the most predictable. So if you want to do immediate loading, do it on a fully edentulous case, and maybe seldom on a single tooth scenario, because the statistics and the literature says full arch cases, if they are rigidly splintered with the prosthesis immediately, or within the first few days after the surgery, by a rigid prosthesis, nothing is going to happen. You will not have any implant failure because of loss of integration or micro motion or anything like that. That is not going to happen. Provided the prosthesis rigidly joins and slits all the implants.